Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemisola because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode. To those who participated in our ongoing Children's Day outreaches, we met quite a lot more of you online, and we also saw some of you in your communities in Kwara, in Abuja, in Adamawa, and many other places where our team did community outreaches. Thank you so much for being part of that. And I know some of you, there's still going to be outreaches even in this month of June. So watch out for a community outreach near you. All right, so today I'm going to be talking about another important topic, and today I'm going to be talking about skincare. And I know one of you will be wondering, why are we talking about skincare at this time? But on our Facebook group, as many of you are aware, we have the Ask the Pediatricians Facebook group where we answer questions by parents. We answer close to 1,000 questions every week. And I think next to the question of food, my child is not eating, how do I get my child to eat? And next to that group of questions, the next most popular kind of questions that we receive is that of skin. We get loads and loads and loads of pictures every day with people asking us, this is my child's skin, what do I do, how do I treat it, what can I apply? You know, that's the typical way mothers ask. They will just put a picture there and they will just say, what can I apply, how do I make it to go away? And then we start to give advice, and we see that a lot of children, really now that for those in Nigeria, we're coming towards the hot, dry season, there are loads and loads of skin conditions that we get daily. And the truth is that some of these skin conditions are actually preventable, especially for the babies. You know, we get loads and loads of pictures of mothers and their babies have one skin rash or the other, and they are not sure what to do. Or some of them have used every cream on the in the pharmacy, like one mother wrote, and the rash has refused to go away. What do they do? So today we're going to, as usual, as our practice, we like to do more of preventive rather than trying to do curative, because as we all know, prevention is always better, and will I say cheaper than cure. So let's talk about how do we kind of prevent some of these rashes, because most of them are actually preventable if we only do the right thing first, especially for the newborn babies and the babies in their first 1 year of life, who constitute the majority of cases where mothers are posting pictures of skin rashes and asking us what to do. And I'm going to explain to us why such babies are actually prone to having rashes too. And we're also going to include things like even nappy rashes and all that, which is also very common, and how we can care for the babies in terms of their skin so as to avoid those rashes. Now, number one, why are babies really prone to having skin rashes? Really newborns and the first few months of life, why are they prone to having rashes? You know, babies have been in the womb, and in that womb, the womb is actually more like an incubator. It's a very conducive environment, and it's an environment that is free of germs, sterile, and no sun, nothing. So this there's no problem with the skin when they're in the womb. They're suspended inside water, and there's a lot of cushioning and everything. So it's always nice there in the womb for the babies. And now, when the babies are born, their skin are actually very fragile. To start with, the skin is the largest organ in the body. Okay, it's the largest organ that covers the largest surface area is our skin. The skin is actually an organ, so it's an important organ that we need to take care of. And so when babies are born, there are some peculiarities about their own skin that actually make them more predisposed to all these rashes. Number one, baby skins are very thin. They have very thin skin compared to adults, or older children. So it means it can easily break, and any little roughness or I will talk about that when we talk about the care of the skin and why. So you'll begin to understand why you really need to be careful and the way you handle the skin of babies. So they are born with very thin and fragile skin and very sensitive as well. And so this is why babies are prone to having rashes. And some of our practices as mothers, some of our regular what I call practice in terms of how we care for babies, we actually damage the baby's skin, and this is why they are prone to having this infection. I remember seeing a picture of maybe 3 days or 4 days old baby, and this baby is covered with what we call septic spot, that small round cyst that has yellow pus inside. The baby was covered all over with it. I mean, how does a newborn baby fresh from the womb have so much of those pores and septic spots all over? Very, very difficult actually to watch. Most of the mothers actually were very upset with that picture. It's because that baby's skin has been handled in a way that causes it to become damaged and make it easier for germs, bacteria to be introduced into it, and then the baby has broken out with a bacterial skin infection that is covering all over. And for babies, these things can easily spread from the skin into the blood because it's a very thin skin, and then the baby is going to be very ill. And so when we see all these things, because of the way we handle our baby skin. Some of us, the way we scrub their skin with all these very strong and coarse and sponges, especially African people from African background. You know what I'm talking about? That concon or sponge. It's very, that's washing of the baby as if we're washing clothes or something. Some of them it actually just damage the skin of the babies. And when the skin is damaged, it is easier for all the germs, the bacteria and the rest of them, even the fungal, they can easily penetrate the skin. All right. And some of us, we just put the babies on any surface. You just carry baby, you put it on the sofa, you put some of these surfaces that we put these babies, even our bed sheet, they are all full of covered in germs that you cannot see with your naked eyes. So it is easy again for a baby who has very sensitive, very fragile skin for these germs to enter into it. Then even when we leave the surfaces or the way we wash and all that, also the products we use. Some of us will buy all these fanciful products, some of them very nice smelling, but they are just loads of chemicals. And these are babies with very sensitive skin. So when you apply all these things, some of us will apply powder, you dry off all the water on the baby's skin, and all those chemicals you're applying to the skin of the baby. The baby is very sensitive to them, then they break out in allergic kind of rashes. So we say that we need, if we have the understanding of the fact that baby skins are very sensitive, they are very thin, they are very fragile, and the fact that some of these our practices can actually cause damage to the skin, then we are going to be more careful. And when we are more careful, then our babies will likely not have the skin rashes. So it is not when they start having the rashes that you start posting pictures, asking the pediatrician what to do. I think the most important thing for us is to start by knowing, being conscious of it, that we need to be extra careful with the way we handle the skin of babies. And then this will also prevent some of these rashes. And then some of us, any little rash on our babies, and the way some mothers will always post questions, they will like, oh, my baby has this rash, and I've applied this product, and they will act surprised that the rash has not gone, or the rash is actually getting worse. And my mindset is like, who gave us the impression that there is one kind of a product, I'm not going to mention this, but you all know what I'm talking about. There's one kind of product that once you apply to baby's skin or baby's rash or whatever, everything else has to go away. I know a lot of advertisement, right? How these companies that make these products is very, and they spend so much money on it, and they seem to be getting us, but that is not true. There's absolutely no products, and I repeat it, and you can quote that to anywhere. There's absolutely no product that is a fix-all for every kind of rash. Okay, in fact, some of these products will worsen the rashes, if used inappropriately. So someone say, oh, this particular product X, as if also baby has rash, that product X is it solves all the rashes. It's not true. Most times mothers don't know why the baby has the rash. They don't know the type of rash the baby has or what is causing that rash, and they just go for product X every time, and then they just apply it, and they come to ATP asking, surprised that the rash didn't go despite them applying that product. And I'm like, what if it's not something the product is meant for? So I know those who advertise those products give you the impression that you can use it for all sorts of rashes. It is not true, and that is just advertisement gimmicks, and it is not true. So don't act surprised. So sometimes those products actually worsen the skin rashes. And also some of us, especially those who live in areas where it's hot and humid, the sun, it's not also very good for skin as well, especially when you take babies out and you expose them to the weather and the elements. Most of the time, people don't tend to take them out for at least for the first few weeks, but afterward we start taking them out. They start crawling all over the places. The exposure to the elements also can also predisposes them. And there's some other things we also do is that some of us like to use all these, I know this also again, people advertise all these medicated antiseptic soap or products, and they give us the impression that when you use them, your babies will not have germs. It's 99.9% germs killing and all that. But the truth of the matter is that there are actually good germs that we need on our skin, and those good germs keep away the bad ones. So that is why the dermatologists will tell you they don't want you to use all this medicated soap, all these antiseptic soap, because when they take away the bad germs, they also take away the good germs as well. So at the end of the day, what the good germs, we call them flora, the normal skin flora. So when you use antiseptic products routinely all the time, then you actually kill those normal skin flora, and the good bacteria, the good germs, when you kill them off, you make it easier for the bad ones to come and take control and create skin rashes, because that's good bacteria. They are there. When they are plenty, they stop the bad bacteria from coming in and doing their harm and havoc. But when you clear them off with all these antiseptics, then you make it easier for the bad germs to have a full day. So again, practices. So I started by talking about the practices that we tend to do and trying to relate it to how it impacts on our baby's skin. And so we need to be mindful, all right, mothers, fathers, and aunties, carers, everyone listening to me, we need to be mindful about baby's skin. Their skins are sensitive, and some babies often have super sensitive skin. Some of us, we know, even you as adults, you still have your skin sensitive. Some of us have dry skin, some of us have other kind of skin. I'm even talking about, this is even general now. This is for all babies generally. Their skin are thin, they are fragile, they're sensitive. Then if baby now even have an allergic tendency to have allergic sensitive kind of skin, then that's even additional layer for that particular baby. So we really need to be mindful of these special situation of our baby's skin, and because of that, we really need to be careful. Okay, so how do we care for the skin of our baby? Because I know that is what you are really listening to. But I started by telling us all the practices that we do consciously or unconsciously, but that have impact on our skin and or the skin of our children. And the skin is a very important organ. In fact, the skin is the organ that covers every other part of our body. And because of that, if we lose our skin, then there are many things that can go wrong. Number one, it is the skin that keeps us from getting dehydrated, from losing water so much. And so that is why the skin has to be intact. Also, the skin protects us from germs, all those harmful germs, the skin help. And so the way we care for the skin is important, because if the skin is broken, then it's easier for germs to come in. It's easier for all those other things to come in. Actually, for mothers who now have preterm babies, their skin is even much more sensitive and much more fragile than the term babies. So it's very important that we take appropriate care of our baby skin. Now, so how do we care for the skin of our baby? Number one, when babies are born, people in the hospital, and this is to our healthcare professionals and nurses, there's no hurry, honestly, in birthing the baby. I don't know why we always rush, we want to birth the baby, we want to quickly cover them and wear clothes and all that, because maybe we want to make sure that when people come to visit the mother, then they can see the baby is looking neat and pretty and all that. But actually, there is no rush in giving a baby a bath. The first bath of the baby does not have to happen on that first day of life. Okay, it's better that the baby is in contact with the mother. Actually, for our preterm babies, we want them to have what we call skin to skin contact and all that, because this helps the mother as well to pass on some of our own flora to the baby. So through that skin to skin contact is very helpful. So there's no rush to quickly give the baby a bath. Rather, the first thing we want is let the baby have a skin to skin contact with the mother. And that's why you see when babies are delivered, most of the time the midwives just put the baby on the mother's chest while they are still doing all the cutting of the cord, delivering the placenta and all that. Number two, it's also good for establishing breastfeeding, because most time babies will wriggle and start breastfeeding, and at the same time they're having skin to skin contact. And research, our dermatologist told us that babies that have this skin to skin contact, they are less likely to have allergic kind of skin issues compared to babies who do not have it. So it is better for babies first to have skin to skin contact. So at some hospital, when we deliver the babies, we just quickly take the baby away from the mother straight to another section to clean up and dress. No, let's let the baby and the mother be together, skin to skin contact. If it's just 30 minutes, 1 hour, that is appropriate thing to do. Then the next thing to do is to actually clean the baby, and preferably with oil, not to start going for soap, like bathing them with soap and everything. No, just clean them, olive oil, coconut oil, not something that has chemicals and all that. I know some of you come to the hospital with all this your nice smelling set of products, and some of them actually have oil inside. But most of those oil, because they smell nice, is because they've added perfumes and chemicals to them to make them smell nice. We should really avoid that. We want the baby to be clean with what we call a natural oil, or something that has no chemicals as much as possible. So we don't have to give the baby the first the soap bath kind of with sponge and all that in the first hour of life. We can delay it up to 2 days. It doesn't have to happen immediately, and that is number one. We just need to clean the baby. That is number one. Then number two, when we're not even ready to give the baby a bath, let's avoid all these antiseptic soap, okay, or medicated soap. He says no, 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 for babies and infants, even our older children. Please, it is a wrong practice. And what we have, just like I explained earlier, these products, they clear out those good bacteria, those good flora that on the skin that normally should protect the skin from the bad ones. And so we want you not to use antiseptic soap. You can use water, clean water is okay to bath the baby. And even some of the time, some of us also had antiseptic like Dettol and Savlon and the rest of the water. I know for those of us that we live in Africa, sometimes our water is not may not be from the, it's not treated yet, so it's not from the tap. Some of us make our home water, and so because of that, some of us are not sure of how clean that water is, and so because of that, we're tempted to add all these antiseptics to the water. But really, as much as possible, we prefer you actually get your water to be clean or boiled and clean rather than adding all those antiseptic soap to the baby's water, because like we said, the antiseptics, they are going to destroy the good flora, and they can also uh, deprive the baby the opportunity to create immune response to all these environmental allergens and all that. So please avoid medicated soap. And if you have to use soap, what the dermatologists recommend is that you use what we call pH balanced soap. Okay, so soap sometimes there are different kind of soap, but pH balanced soap or cleansers for babies. And these days, if you go to the shops, you always see they will write it on it that this is tested, dermatologically recommended for babies, balanced. There are different brands like Sebamed, like Dove, like Aveeno. So these are examples that some of us are very common with. This is not an advertisement for this product. Really, if I have my way, I won't mention the names, but some of you, some of our parents are going to be asking, how do I know which one is the pH balance, which one is this? So that is why we just have to give an example of some of these brands. They are not the only brands. There may be other brands, but check what is written on it. Check the pH. Is it balanced pH like 7? Is it free of chemicals? Is it hypoallergenic? These are some of the words that may be written on it for you to know that that's appropriate kind of soap that is close to the normal acidity of the healthy skin, and that is the one we want you to use for your babies. And if you don't want to use any of these fancy name kind of, the normal black soap, the African black soap, is actually a very good one as well, and not the ones that people are producing these days so that they've added perfumes to it and make it smell nice. But if you look for the real black soap sold in the market without any chemicals being added to it, the real black soap is also a very good product that you can use. So these are the things you should use for the baby bath: pH balanced soap or cleanser, and no more clean water, no medicated, no antiseptics, nothing. This is what we should use to bath our baby. For the water, you can just boil the water and then cool it, so that will kill all the germs in it, and you can use that without necessarily having to add antiseptics for those of us who are worried that our water may not be clean. But if you are getting your water from the government, tap water, treated water, you don't even need to do all that. So, and then when it comes to the bath itself, some of us like to use all these sponge. In fact, there's a lot of videos circulating on Facebook, and you see all these and I think it's Yoruba culture that babies have to be scrubbed with palm oil, and they have to use this kind of sponge. That sponge is very harsh, even for adults, not to talk of newborn babies, and they use it to scrub that baby. Most of the time, they end up damaging those babies' skin, and those are the kind of babies I tend to see. Then you see a 5-day-old baby, 8-day-old baby cover with pores, skin rash and pores. Most of the time is because, and some of these sorry, apologies to the grandparents, I'm not accusing you, but sometimes they are the one that tend to perpetuate this practice. And some of the people doing this thing, they will even wash their own hands. They will just rub the baby with all this oil and arch sponge, and then the other things they are going to apply to the baby's skin. Those are things that even, create germs into the baby's skin, and then you see these babies covered with pores, bacterial infection, and all that. So let's avoid that. So please, there's no need. Babies don't need this harsh sponge when you're giving them a bath. They don't need it. They don't need that harsh sponge. You can, if you just using your soap and water is enough. But if you are the type that if you don't use sponge, you will not be comfortable, please go for something soft. Those foam one, those very foam and soft one. Those are the ones that gently just rub on the skin, or you can just use a face towel, the small face towel. You can use it as your sponge, and the kind of soap we've mentioned, and water. That's all you need to give your baby a bath. And for those of you who live in temperate countries where the weather is not so hot and humid like we have in Africa, you don't have to give your baby bath every day. Those who even live in cold, very cold environment, sometimes every 2 days or 3 days is fine. But for those who live in Africa, because they tend to be hot and humid and sweaty, it's okay to give your baby a bath, but once a day is enough. So baby is not going out, they are not carrying sand, and they are not like going out and being exposed to so much dust and stuff. So they don't need to have twice, 3 times daily bath. Once a day, in the morning or in the evening, depending on whichever one you want to create into your schedule, is fine. Okay, please use pH balanced soap without chemicals, no medication, no antiseptic. Use clean water. You can boil it if you're not sure, and use soft face towel or sponge to rub the skin. Please don't use those very harsh sponge. And that practice where we tend to give babies palm oil scrub. Like, people say they don't want them to have body odor. And I always tell Nigerian, especially African mothers, who always claim that's what the grandparents said about that myth. There are many, many people in the world who don't have our palm oil, who don't do that practice. How many of them have body odors? Okay, so in other words, we should have been the only people who don't have body odors. Every other person should be having body odor, but that is not true. All right, so that means it is not true. It's just a false myth or belief that until you scrub your baby with palm oil for the first bath, then they will have body odor. It is not true. So throw it away, and you don't need to do that. Okay, so we've talked about water, the soap. Now, what do we apply on the baby's skin? This is now the most important thing, because there's so many products, creams, lotion, oil, and everything. And like I said, a lot of these companies, they tend to make them as a branded combination, the soap, the lotion, and everything. And a lot of others, and even powder and everything, and they just apply everything. Now, what we need to apply on the baby's skin is just soft moisturizer. Okay, a good moisturizing cream or oil. You please, no powder. Okay, most people will do the cream, then they will not apply powder. You see, the powder, what powder does is to dry up the skin, and when the skin is dry, it's easier for you to tear, and it's easier for you to get infected and have all these things. So we want to apply something that will moisturize, that is, that will keep some water trapped into the skin so that the skin will not be dry. So, and there are lots of them, but more importantly, you don't want to use something, because like I said, babies' skins are sensitive. So you want to use things that we call hypoallergenic. In other words, moisturizer that are unlikely to give the baby an allergic reaction. All right, and there are, again, many of them. But if you don't know, if you go for the natural products, okay, go for your normal olive oil, your normal coconut oil, your shea butter, natural, they will not, they are hypoallergenic. Your Vaseline without perfume, the blue seal type, or there are other brands as well. Again, we've mentioned like Sebamed range of product. They are moisturizer, lotion, is all your baby needs on their skin. Please do not apply powder to the skin of baby. So apply it in the diaper area especially. Okay, so no powder, just use moisturizer. And for babies that especially have tendency to dry skin, sometimes you have to apply it several times during the day. It doesn't mean that it's only when they have a bath that you have to apply it. And then some of us also use some of these wipes. If you also, again, if you are going to be using wipe to wipe the baby face and all that for anything, please go again for something that is hypoallergenic. Maybe just water inside, no other chemicals. Most time they don't smell any, because those smells usually chemicals. So you want to make sure you are using things that is not likely going to make the baby to have a reaction. So this is the basic skincare of babies. And while I'm still on the moisturizers and oil that we can apply to our baby's skin, I'm also going to quickly talk about another dangerous thing that a lot of us do, especially in Nigeria. At least I've come across this a lot. Is the people who will tell you, go and mix certain products into your baby's lotion so that it will keep your baby's skin to be fair. Now, most of us Africans, we know we're black skinned, and there's nothing wrong with black skin. Black is beautiful. But when babies are born, because they've not been exposed to a lot of sun and all that, and so most of the what give our skin color, we call it melanocytes. It's not here producing that melanin as such. So they come out looking fair, looking Caucasian-like, if you like. And so a lot of mothers like that fairness of the babies, and they will say, oh, I want to maintain my baby's skin fairness. And I've written this before, and I will say it again. Your baby's skin color is genetic, all right? It is not you that determine your baby's skin color. If your baby is going to be black, it's already determined when your baby was being formed. So the gene you pass to your baby for skin color is black. Maybe you and your husband are black, so you're going to pass the black skin color to the baby. If you are fair, or somebody in the generation down is fair, you pass on the first skin color gene to your baby. So most babies are, even the black babies, they are born looking fair because they've been inside a very enclosed surface with suspended in water, protected from the elements, from sunlight and all that. So most babies are born fair. It doesn't mean they are not going to be, this doesn't mean they are going to be fair forever. Okay. The black skin one are still going to be black, no matter what product you put on their skin. So don't let anybody deceive you, because this is another question mothers ask me, oh, my baby was fair, but now my baby is turning black, my baby is turning black. I want to maintain my baby's skin color. What can I use? Oh, they say I should use this product. Please don't listen to those people, though. Don't listen to them at all. If your baby's genetic skin color is black, your baby is going to be black. And there's nothing wrong with being black. I'm black, I'm beautiful. All right. And so if your baby is going to be fair, your baby will be fair. You don't need to maintain anything for a baby to be fair. A baby who is genetically fair in skin will be fair skin if you use ordinary Vaseline on that baby's skin. All right, and olive oil. You don't need any special maintenance for baby skin. Okay, so please don't mix drugs. Okay, a lot of people will not tell you, okay, go and add, and I'm going to mention names because I want you to know what you should not do. Even though normally I don't like to mention it because I don't want to do advertisement for these companies. A lot of people mix Kenel, and some people mix from but what is I've forgotten the other name, but you know the names of all these products that you people mix into the baby's skin cream, and people do this and use it every day on the skin. Most of these products I just mentioned, they are what we call triple action creams. They have steroid inside, they have antifungal, antibacterial, and these products are not meant to be creams. They are not meant to be moisturizer that you use every day. These are drugs. They are meant to be prescribed, and they are meant to be used maybe for a certain number of days or weeks to treat a child who already has a particular condition. They are not your regular skincare products. Please, let's stop that dangerous practice, okay? No, don't mix nothing into your baby's lotion or moisturizing cream. I've told you what you can use. Use hypoallergenic skin product, your coconut oil, your shea butter, your Vaseline Ori, olive oil. They are fine enough to use. If you want to go fancy, your Sebamed, all those ones, they are fine to use. Please don't go and add skin oil to that product, to the cream of your baby. Don't go and add from back A. Don't go and hack. There's another one, I'm trying to remember the name now. So you know how this product that people use. So please do not add them. Okay, also see something that is meant to be a drug, that is meant to be used for treatment. Please don't go and add it to your baby's cream. And somebody say, oh, anytime I stop it, your baby will have rashes. Your baby will have rashes because you are destroying that baby's skin, putting all those things. These steroids are being absorbed into the blood of the baby. Remember, the baby's skin is thin and there are blood vessels running through it. So when you apply steroid containing products to your baby's skin, they are going to get absorbed, and steroids can cause a lot of damage and side effects. Okay, they can make a baby to be short, they can cause ulcer, they can make babies to be fat, obesity. They can cause all gastritis. So many things they can do. So please do not mix anything into your baby's skin product. If you have started, please throw those products away and do not use it at all. So use just something that is natural or hypoallergenic, and that's what you can use, and you can apply it several times. If it's drying up, you can apply it. And so another thing that some of us do is the oil. We put oil on the baby's scalp like per second, and people believe that there's the anterior fontanelle, that place soft, on the and closer to the forehead, and people believe that as if it's a wrong thing. I've written about Oka and all the rest before, but let's just talk about it and say anterior fontanelle is a normal part of the baby's skull. It's just a space covered with skin, and it's meant to be there because the baby's head is small and the brain is growing. So those spaces are deliberately left in the brain by God so that it will accommodate the brain growth. It is not an illness. It is not a disease. Whether you see it positive or you don't see it positive, doesn't mean anything. It is there. All right. So you just leave it alone. And you don't need to be applying oil on it. There's a myth that it should never be dry. That is not true. That is a myth. You don't need to be applying oil on it second by second, because what normally happens is that some of this oil that we apply on it, they tend to drip down the face of the baby. And when they drip down the face of the baby, they cause rashes. Okay, so please, you only need to apply oil once a day, maybe 1 or 2 drops, just to keep the scalp moisturized and keep the hair moisturized. You don't need to apply oil every second. And while I'm still on the point of oil, another thing practice that most of us mothers do is to put eucalyptus oil into our baby oil, because eucalyptus oil is believed to make babies to sneeze a lot, and so that their nose will not be blocked with catarrh and all that. So mothers always would have mixed the eucalyptus oil into the oil, and then they will apply it again. This eucalyptus oil can make somebody to have rashes. They can react to it. They can be sensitive to it. Even more, if the baby will just be sneezing. So usually when a typical Nigerian mother tells me my baby is sneezing all the time, I always ask them, are you using eucalyptus oil? That is silver bed. Have you mixed it into your baby's oil? And 99% of the time I'm correct. And I think I'm getting less of it now because people are now aware that they don't need to do that. So please, eucalyptus oil or silver bed oil is not written in the Nigerian constitution that you must always put it in your baby's oil, and you must always be part of your pack that you take to the maternity where you want to have your baby. Please, it is not. It's good when your baby is having blocked nose and you want something that can stimulate the baby to sneeze, but it's not something we want you to be using like every day, or putting it into baby's oil and using it every day of the baby's life. No, please. So one drop of oil in the day, in the morning time, as part of your routine when you're having the bath and all that, it's okay. Please don't keep applying oil every second, and please do not mix eucalyptus oil into your baby's oil. So this is basic skincare for the babies, and no powder. Okay, a lot of people just like the powder, and they're like, Dr. Gbemi, when can we start applying the powder? And I will say, no, you don't need to apply powder. It is never necessary. All right, just keep your baby's skin moisturized. That is all. Okay, now there are some rashes babies have when they are born that is normal. Okay, so sometimes baby have all these white dots. I wish I have time to show us pictures, but today I'll just show. Maybe another time we'll come and talk about the different kind of rashes. But I just want to mention them in passing, because sometimes we're trying to solve a problem that does not exist in the first instance. We create another one. So some rashes are normal, and you don't need to treat normal. You don't need to do anything. So sometimes babies are born, newborn babies, especially the first few days, you see they have all these white dots all over their face. That is called milia. Okay, if you go on our Facebook group or website, you may see the picture. It's milia. It's very common. Milia is normal. You don't need to do anything. It's going to clear by itself. Milia looks like a white dots like that all over the face. You can't miss it. Once you see, this is milia. Okay, so you just leave it alone. No, it's going to clear by itself. Don't go and use that your product X that you believe is supposed to be a cure for all rashes. Just leave it alone, because when you use what you should not use for what doesn't need anything, you're actually going to now create another problem, and then we'll have to start dealing with that. So leave it alone. Another thing that is common is itch rash. So the itch rash looks like a small cyst of water, as if water is trapped. And this itch rash, we call it malaria. There are these two kinds. There's the white kind where it looks like a white cyst. It's different from milia. Milia look like a white dot, like there's no water, just the dot, and it's white. But the itch rash look as if there's a little bit of water or a little bit of swelling, a little bit different from, and sometimes it could be red. Malaria rubra, there's also malaria crystallina, and that is a white one. But it's just itch rash, and I think most of us are quite familiar with that. Again, you don't need to do anything for itch rashes. Most of the time, our babies have itch rashes, especially in Africa, because we tend to over cover them. Part of some of our myths or beliefs around childcare is the fact that the baby must not be exposed to breeze, and if they're exposed to breeze, they are going to catch cold, they are going to have pneumonia. And so people dress newborn babies like they are going to the moon, or they are Eskimos or something. So you see them wearing a hat, wearing socks, wearing mittens, wearing thick, maybe 2-3 layers of clothes, and then they still wrap them again in this heavy duty shawl. Why would the baby not sweat? And then people say, oh, my baby is always sweating. And I'm like, why would the baby not sweat? When we wrap the baby, we put on the cap. And I always tell mother, it is also not written in the constitution that your baby has to wear a cap or a hat. So mothers will like panic if they should forget to put on a hat on the babies. In the hot Nigerian sun, please, you don't have to do that. Teach it. So I always tell mothers, dress your baby according to the weather. You are all very intelligent and sensible mothers. You all know what to do. You know how you dress when you are hot. You know how you dress when you are cold. It's just the same sensible approach when it comes to babies. So if the weather is so hot, very sunny, you don't need to wear cap and socks and mittens. Just wear a light cotton wear, even just that vest, white vest that all of us always buy, and the nappies is enough. That's all. If the weather is looking cloudy, cold, then you can wear maybe an extra layer, and maybe you can wear socks. And always teach mother a simple trick. If you put your hands on your baby's palm, you will feel how their temperature is. So if your baby's arms, palms, or feet are hot, warm, sweaty, that baby is overdressed. So shed some layers. If it is feeling cold, that baby is likely cold, put on more layers. So just use your and also see your baby is sweating so much. The layer is too much, reduce it. Okay, baby should not be sweating so much, because when they sweat so much and the sweat cannot easily flow out of the taken care of, then it's going to get trapped, and that is what causes the heat rash. So make sure the windows are open. So the room of a new mom should not be like a oven. That's how you know some new mom's room is so stuffy, it's so hot, because of the wrong beliefs around that. So please open your windows. You can use your AC with your newborn babies. You can use your fan with your newborn babies. All those things are not true that they can't use fan. You can't put on AC because you have a newborn baby. No. Put on your fan, put on your AC on hot, so it regulates it again. Everything is about being, making sure the baby is cool but not cold. Making sure the room is cool, not hot, not cold. I'm sure you know how to figure it out. Okay, so just so that the baby will not have heat rashes. So the only time we allow you to use powder is if your baby has heat rashes, and then you can use the so-called heat rash powder, and there are a lot of them, but preferably the one that doesn't have menthol. It shouldn't be hot heat rash powder. It should just be cool one, mostly powder, no menthol inside. So you can use that. But more than even powder for heat rashes, the most important thing is to keep baby cool and dress them sensibly, like I just mentioned. And at most times, again, I also need to sign a note of caution at this point, because mothers tend to diagnose heat rash for every rash. I've just described heat rash to us now. It is like water cyst trapped. It can look white, it can look red. But if your baby's skin color is different, that is not heat rash. If your baby has what look like yellow pus under the in the skin, that is not heat rash. That is septic spots, that is bacterial infection, what your people call a leaf-4 and all those kind of things. So please don't make diagnosis of heat rashes for everything, okay? If you are not sure, again, you can always ask the pediatrician. So all you need to do is to put a picture of it on our group and we can tell you, because I see a lot of picture. Oh, I think it's heat rash. I think it's heat rash. No, it is not. It's not heat rash. And usually heat rashes will clear within days or max 1 week, because once you keep the baby cool or use your heat rash powder, they will clear. They don't need any long-term treatment. So if your child is having rashes coming for 1 month, 2 months, it is not heat rash. Don't even fall for that. It is not heat rash. So that is basic skincare. Before I leave, I also talk about the nappy area, because that's another area where babies tend to have rashes. Nappy area care is very important. Please, the most important thing is that the nappies have to be changed. I know times are hard, and sometimes mother just feel I can't keep changing. So just always use disposable nappies. Okay, let's quickly settle the question: or should I use disposable, or should I use the regular nappies? There's no wrong one. Do what works for you. If you are more comfortable washing, then use the regular nappies, the old one, the clothes nappies. Or if you are the type that you're a busy mom, always on the go, then disposable nappies will be your option. So do what works for you. But for us, the most important thing is that nappies have to be changed when wet, not only when dirty. Okay, a lot of mothers don't change nappies until there's a poo inside. No, even the wee has to be changed, because this nappy is in contact with the skin of babies all the time. Now, the poo and the wee inside the nappies, they are irritants to the skin of the baby. All right, so if you don't change them and you leave the poo and the pee or the wee to be in contact with the skin for hours, it's going to cause skin rashes. There's no rocket science there. That's what's going to happen. So number one, to avoid nappy rashes, you need to change the nappy often. Sometimes you have to do it 8 times a day. Yeah, sometimes you have to do 12 times a day. I know you don't like that, but that is the truth. That's what we have to do. Okay, so that's number one. Number two, before you change nappies, wash your hands, please. As mothers, we touch a lot of things. You are carrying a lot of germs in your hands, okay? And it doesn't bother you. But this baby's skin is thin, it's fragile, it's sensitive. So you really need to wash your hands, okay? Before you change nappy, wash your. I know you think you should do it after, you should do it before, okay? Then after you've finished, you should wash your hands again. Then when the baby has done a poo or a wee, you need to clean them. Water is actually best, okay? Water is the best way to clean your baby's nappy area. But I know some of the time you are outdoor, you don't have your bowl and water and all that. Then you have your wipes, but please make sure you use wipes that are hypoallergenic, okay? Really, they should write it on it that it's hypoallergenic, something that doesn't have so much chemicals, because some of those wipes too can actually irritate the skin of the nappy area. So use wipes that are hypoallergenic, and more importantly, nappy cream. You must use only a cream, something that is a barrier kind of product. No powder. No powder. Powder is the most dangerous item to apply in the nappy areas, and I see a lot of mothers do that all the time. They will use the normal Vaseline or pseudo cream and all that, but then they will still apply powder on top. What you are creating is a paste, because the powder will mix with the urine of the poo and form a very horrible irritant paste, and that is what will cause the child to have skin rashes. It will irritate the skin, so the skin will become broken, and then when you now come to change the skin and you don't wash your hands, you bring in the fungi, you bring in the bacteria onto that broken skin, the child is going to have rashes, infection, not even just an irritation kind of rash, but now the infection kind of rashes. So it is very important that we get this right. Number one, use the right kind of nappy, the right size, and preferably the one that is cotton, not the one that has rubber, because some maybe it's actually allergic to the rubber in the nappies. So if you look at the top part of the nappies, check that it's cotton, and if it is rubber, if your child doesn't have rubber allergy, fine, but some children have it, so it's better you avoid. Generally, it's better to avoid rubber kind of nappies. 2, you need to change the nappies frequently. 3, wash with water or hypoallergenic wipes. 4, wash your hands, please. Wash your hands with soap and water before and after. 3, is it 5 now? Please apply what we call barrier kind of nappy cream. All right, don't use powder. So you can use pseudo cream, you can use your normal Vaseline, you can use your shea butter. It doesn't cause infertility in the boys, that's a myth. You can use your zinc oxide. Those you must apply, and you must apply it to all the nappy area, including the thigh, the perineum, the surfaces that fold over each other. You must apply it there before you put in the nappies. So change nappies frequently, wash with soap and water, wash your hand with soap and water, use cream or ointment, anything that is a barrier, no powder, and your baby will not have nappy rashes. Yes, it's possible not to have nappy rashes at all. All right, so that is how to care for the nappy areas. All right, so for the past almost an hour now, I've been talking about the skincare of our babies. So today's not talking about rashes in particular, but I just want to talk about things that we can do. Now, in conclusion, if your baby now has rashes, even though I know some of you say, oh, Dr. Gbemi, I do everything. I use Severmed, I do everything you've said. I follow everything to the letter, but maybe still have rashes. Your baby can still have rashes, okay? Because all that I've said is to protect your baby from infection. It's also protect your baby from allergies and all that, but your baby can still have rashes for other reasons. Okay, some people have allergic condition like atopic dermatitis. Your baby can still be exposed to germs even though you're making all the effort. Okay, so there are other reasons why your baby can have rashes even though you've done everything. So don't feel bad. A lot of mothers feel so bad, like I've done everything, so why should my baby have rashes? Your baby can still have rashes even though you've done everything. So what you need to do is to come to the doctors, the pediatricians, and let's examine your baby and know what kind. Please do not self-medicate rashes. Mothers do this a lot, and it's just difficult to deal with because sometimes you make it worse. Sometimes a baby is having bacterial infection, then you go and apply triple cream that have steroids. Then the steroid is going to make a bacterial infection worse. And that's why some of you say, oh, the more I apply this product, it make it worse. So preferably see your pediatrician or your dermatologist. Not every doctor, even some doctors don't really know how to manage these rashes. Those are the ones that tend to prescribe all those your triple action products. Because triple action means I don't know what I'm doing. just use this thing, whether it's fungal, bacterial, or steroid, to cover everything. No. If it's a fungal infection, we won't use a fungal cream. If it's a bacterial, we want to use antibacterial. If it is allergy, we don't want to use steroid. We don't want to use everything together. So I don't like that idea. So please see your doctor, see your pediatrician, and then they can. But before you see them, don't do anything. There's no one magical product that solves every problem. I see a lot of mothers, when people post on our Facebook group, before we even answer, a lot of mothers, hey, yes, this is ABF. I wanted to remember before. Go and apply ABF. Go and apply this. No, that's not how things work. And don't take those prescriptions from other people, or go and use flour. Go and boil flour. Drink water. No, don't take any of those agbo or prescription from people. See your pediatrician, see your doctors. And even when your doctors have treated your baby, if things don't get better, don't say that means the doctor doesn't know what they're doing. There are reasons why it could be, but my time is up. Maybe I'll come back next week for that. You just go back to them. Okay. Some skin conditions are recurrent. They are allergic. They will keep coming and going for a long time. That is the nature. It doesn't mean the doctor doesn't know what they're doing. We just manage it. We cannot cure it. An example is atopic dermatitis. So that is how it is. So running from one doctor to another, from everywhere, it's not going to help you. Just relax and go back to the same doctor. All right, so I hope you've learned a lot on how to properly care for your baby's skin. Maybe next week I'll talk more about the rashes and the approach to management. Thank you so much, and have a wonderful, wonderful day. If you have any question, please post your question directly to Ask the Pediatrician Facebook group, and we shall answer that. Remember, when you're asking questions about rashes, start with the age of the child. Tell us about the rashes. Don't just put a picture. A picture alone is not enough. And then we'll be able to answer it. Thank you so much, and have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.